Aortic stenosis, understanding the narrowed heart valve. Aortic stenosis is a cardiovascular condition that affects the aortic valve, a crucial component of the heart responsible for regulating blood flow from the left ventricle to the rest of the body. In this comprehensive guide, we will explore the causes, risk assessment, early warning signs and symptoms, diagnosis, and real-life stories of individuals who have faced aortic stenosis and their inspiring success stories. Learn more about aortic stenosis. Introduction. Aortic stenosis is a medical condition where the aortic valve narrows, restricting the flow of oxygen-rich blood from the heart to the body. This condition can be congenital, present at birth, or develop later in life. What causes aortic stenosis? The primary causes of aortic stenosis include congenital defects, age-related degeneration, and other medical conditions like rheumatic fever. These factors contribute to the calcification and narrowing of the aortic valve. Types of aortic stenosis. There are three main types of aortic stenosis: congenital aortic stenosis, calcific aortic stenosis, and rheumatic aortic stenosis. Each type has distinct characteristics and risk factors. Risk assessment for aortic stenosis. Assessing your risk of aortic stenosis is an important step in maintaining heart health. Several factors can contribute to the development of aortic stenosis. Age. Aortic stenosis is more common in older adults. As we age, wear and tear on the aortic valve can lead to stenosis. Family history. If close relatives have been diagnosed with aortic stenosis, you may be at a higher risk. There may be a genetic component to the condition. Lifestyle choices. Smoking and a diet high in cholesterol can contribute to the development of aortic stenosis. Smoking damages the aortic valve, and high cholesterol can lead to calcification. By assessing these risk factors and discussing them with your healthcare provider, you can better understand your likelihood of developing aortic stenosis and take preventive measures if necessary. Early warning signs. Recognizing early warning signs is crucial for timely diagnosis and intervention. These signs may include chest pain or discomfort, fatigue and weakness, especially during physical activity, shortness of breath, particularly during exertion, irregular heartbeat or palpitations, dizziness, lightheadedness, fainting or near fainting. Signs and symptoms. In addition to the early warning signs, there are other signs and symptoms of aortic stenosis, including swelling in the ankles, feet, or abdomen, rapid or irregular pulse, heart murmur, which your doctor can detect during a physical examination, angina, chest pain or discomfort, often radiating to the neck, shoulders, or arms, difficulty exercising or feeling overly tired after physical activity, dizziness. Diagnosis of aortic stenosis. Diagnosing aortic stenosis involves a combination of physical examinations, imaging tests, and echocardiograms. Early detection is vital for effective treatment. Aortic stenosis and pregnancy. Pregnancy is a special time in a woman's life, but it can pose unique challenges for those with aortic stenosis. Here are important considerations for women with this condition. Pre-pregnancy planning. Before conceiving, women with aortic stenosis should consult with a cardiologist to assess their heart's condition. The cardiologist can provide guidance on managing the condition during pregnancy and minimizing risks. Increased cardiac demands. Pregnancy places additional stress on the heart due to the body's increased blood volume and the demands of the growing baby. Women with aortic stenosis may experience more strain on their already compromised heart. Risk of complications. Aortic stenosis can lead to complications during pregnancy, such as heart failure or arrhythmias. It's crucial to closely monitor the condition and have a healthcare team in place to manage any issues that may arise. Specialized care. Women with aortic stenosis require specialized care during pregnancy. This may involve more frequent checkups, echocardiograms, and consultations with cardiologists and obstetricians who have experience in managing high-risk pregnancies. Delivery planning. Decisions regarding the mode of delivery, vaginal or cesarean, should be made in consultation with healthcare providers. The choice will depend on the severity of aortic stenosis and individual health considerations. Postpartum care. Care and monitoring should continue after childbirth. Some women may require interventions or procedures to address aortic stenosis once their health stabilizes post-pregnancy. Understanding the risks and closely following medical advice can help women with aortic stenosis have a successful pregnancy while safeguarding their health and the well-being of their baby. Real-life stories and success stories. Real-life stories. John's journey to recovery. John P., a 50-year-old teacher, was diagnosed with aortic stenosis. He underwent a successful aortic valve replacement and is now leading an active life. Emily's triumph over congenital aortic stenosis. Emily K. was born with congenital aortic stenosis but received early diagnosis and treatment. Today, she is a thriving teenager with boundless energy. Mary's courageous battle. Mary's journey through aortic stenosis was marked by resilience and determination. Her story inspires many. Robert's heartfelt recovery. Robert's heart was mended through aortic valve repair. His journey to recovery is a testament to the power of medical advancements. Laura's new lease on life. Laura H., a grandmother, found hope after aortic valve replacement. She is now enjoying precious moments with her family. Success stories. Sarah's remarkable rehabilitation. Sarah R., an avid hiker, faced aortic stenosis. After aortic valve repair, she not only regained her active lifestyle but climbed some of the world's tallest peaks. Mike's second chance. Mike's diagnosis of aortic stenosis came as a shock. He opted for a minimally invasive procedure and is now enjoying quality time with his grandchildren. Ella's path to wellness. Ella J., a retired nurse, successfully managed aortic stenosis. With lifestyle changes and medication, proving that non-surgical options can be effective. Sam's inspirational recovery. Sam's journey through aortic stenosis showcases the importance of family support and determination in the face of adversity. David's triumph over rheumatic aortic stenosis. David T. overcame the challenges of rheumatic aortic stenosis, underscoring the significance of early diagnosis and intervention. Conclusion. In conclusion, aortic stenosis is a serious heart condition that necessitates prompt diagnosis and treatment. With advancements in medical science and the inspiring real-life stories and success stories of individuals who have overcome aortic stenosis, there is hope for a brighter future for those facing this condition. FAQs. 1. What is the main cause of aortic stenosis? Aortic stenosis can be caused by congenital defects, age-related degeneration, or other medical conditions like rheumatic fever. What are the complications of untreated aortic stenosis? Untreated aortic stenosis can lead to serious complications, including heart failure. Is aortic stenosis common in children? Aortic stenosis can affect individuals of all ages, including children. Pediatric cases require specialized care. Are there ongoing advancements in the treatment of aortic stenosis? Yes, ongoing research is improving our understanding of aortic stenosis and enhancing treatment options for patients. What are the risk factors for aortic stenosis? The risk factors for aortic stenosis include age, congenital heart defects, and a history of rheumatic fever. Learn more about aortic stenosis. Your health matters for us. Quali.health